All right, thanks, Sam. Recently, there have been many developments and innovations helping to improve the quality of orthopedic health care. Here today to talk about the new advancements in orthopedics is Dr. Jordan Gruskay, a specialist in sports medicine and joint preservation surgery with Connecticut Orthopaedics. Doctor, welcome.
Thanks for having me on the show.
Thanks for being here. So, can you first help us to understand the difference between joint preservation and joint replacement surgery?
Yeah, absolutely. So joint replacement is the treatment of choice for end-stage bone-on-bone arthritis. Arthritis is the loss of the cushioning or cartilage in a joint. So joint replacement involves replacing the patient's diseased joint, replacing it with plastic and metal implants, and this has a long track record of success. However, there are many patients who have pain and disability who are not good candidates for joint replacement. Typically, these are younger patients who are more active and maybe who don't have severe damage in their joints. And these patients may have had prior traumatic sports injuries or maybe prior procedures that have led to some early joint damage. In those patients, we typically look to try to do joint preserving procedures, whether those be conservative management through injections or through actual surgical procedures that keep the joint in place and help alleviate their pain.
All right, doctor, can you tell us a little bit more in detail about what that joint preservation what options exist for those younger, more active patients?
Yeah, absolutely. So really with any patient, we would start with a course of conservative management. This typically consists of physical therapy, sometimes bracing, and even targeted injections. I think in most patients, we're able to get them to a relatively good envelope of function with just these methods. However, there are a few patients who continue to have pain and lack of function, and it's in those patients where I would consider joint preservation options. There's some exciting advancements coming out. In one procedure, I can actually take some of the healthy cartilage from someone's knee, grow it in a lab, and then replace it 6 or 7 weeks later, resurfacing the damaged area of the joint. There's also procedures called osteotomies, where I realign the joint, taking the weight-bearing surface from the area that's damaged into a healthier part of the joint.
That's pretty amazing. Wow, what an option. All right, what about active patients with chronic hip and groin pain?
Yeah, so this is actually really interesting. We're starting to realize that many patients who have been diagnosed with a groin pull or a hip strain and who have been dealing with it for months and months and months actually have something called a labral tear. So the labrum is a ring of cartilage that stabilizes the hip joint. Certain types of labral tears can lead to chronic hip pain and even early onset arthritis. So fortunately, there have been many minimally invasive procedures that have been developed that can treat these labral tears. What this does is, one, take away the patient's pain at the time of surgery, and two, can even possibly prevent early onset arthritis down the line. Now, the interesting thing is studies have shown that many patients with this diagnosis have seen 2, 3, or even 4 doctors sometimes before getting the correct diagnosis. So I would say if anyone's out there who has had chronic hip pain, groin pain, typically right in the front of the hip, sometimes out to the side, and you've tried anti-inflammatories, you've tried PT, and nothing's getting better, you may have a labral tear, so ask your doctor about that.
All right, Dr. Jordan Gruskay, thank you so much for joining us. Good information.
Absolutely.